Today on Trial Lawyer Nation, I am joined by my partner, Malorie Peacock. Malorie, how you doing today?
Good. How are you?
I'm doing great, and we are going to continue our trial series. And today we're going to talk about the effective examination of treating doctors.
Yeah. Yeah, I think this is a great segue from our last trial series episode, which was the 30-minute witness. And I think we're building on that to talk about how do we do a treating doctor in 30 minutes?
30 minutes? What you mean 3 hours?
No, I do not. And please do not do your treating doctor in 3 hours. People will fall asleep.
Absolutely.
So I guess let's kick it off. So a couple of years ago, Michael, you kind of developed this template for how to direct a treating doctor and keep it tight and keep it simple and hopefully do it in under 30 minutes. So first of all, what was your thought process in developing sort of that template for deposing a treating doctor?
Well, there's a few things. I mean, number one, what do you need to persuade a jury to put the answers you want on a jury form? So basically, how do you persuade a jury that your client was injured, that they needed treatment, and that they're suffering things in the past and they're going to continue to suffer things in the future? So how do I make the testimony persuasive in that manner? How do I keep the jury awake and non-confused while they're doing it? And then if I get a verdict, how do I keep it on appeal and make sure I do everything that the law requires to do that, which is I need to show that the doctor is qualified to give these opinions, that the opinions are reliable, that they're based on a reliable foundation, and that there's good science behind them, and that the doctor has done the work. And again, I need to do it in plain English, simple, and as quickly as possible. Not to say that you rush it, but you also don't go through every single visit and every single finding and make it so boring that people fall asleep.
Yeah, I think when I first started doing treating doctors, I was so nervous about making sure that I got everything that I needed to get, that I would go through every single record of every single visit with the doctor. And I mean, the jury doesn't need it and you don't need it to support your doctor's opinions,
Yep.
really.
And hopefully you have a doctor that doesn't need it too. That's another issue we have sometimes with treating doctors, that they want to read their entire record to you. So it takes a lot of work. It takes a lot more work to do a 30-minute treating doctor deposition or direct examination trial than it does to do a 3-hour one.
And just like with every expert witness, your doctor has to meet whatever the Daubert type requirements are in your state. So when you're creating your outline, you want to be thinking of your doctor as an actual expert, not just a witness in the case. But what do they have to show their methodology, their qualifications, all of those things without overdoing it? Because remember, you're doing this for the jury. You're also doing it to keep your verdict on appeal, but you're really doing this for the jury. And if they've fallen asleep by the time your doctor gets through his qualifications about where he went to from high school forward, then you're doing a disservice to your case.
And I do want to mention before we get to the actual direct exam, because this is something that's fairly new, but I see the defense bringing it up and I see some disturbing case law on it. So there is a growing line of cases that says that while a treating doctor can testify as to what they saw and did, if you want a doctor to testify about causation, that an event caused the condition, or if you want a doctor to testify about anyone else's medical bills besides the doctor's own medical bills, that you must not only designate the doctor as an expert, but in cases and in jurisdictions that require reports like federal court, uh, and there's even one of the districts in New Mexico State Court I heard is doing this too. You must provide an expert report from that doctor, and these courts are saying that the medical records aren't good enough, but you need to have an expert report where they explain how they came to their conclusion on causation, what their reasonable basis was, which is hopefully a differential diagnosis, and we can go into that in a little bit. But I just want to warn everybody because I almost got burned on this, and we've been doing this, and we're having to fight with the doctor sometimes because they're like, I've been doing this for 40 years, and I've never had to write a report. And I said, well, I've been doing this for 30 years, and until 2 years ago, I never had to get a report either. But if we want to get to trial and not have our case thrown out, a lot of jurisdictions, especially federal court, are requiring us to do like a full. They're treating them as hybrid experts. So to the extent that they're treating, then they're just, their medical records are good enough. You don't need to get a report. But if you want them to say, did the crash approximately cause the injury, then you're needing to get a report from them. Or if you're wanting them to say, were these other medical bills reasonable in their price? Was this other medical treatment that other people did necessary? You're needing to get a report from them explaining their methodology and qualifications.
Right. And I mean, generally, if you're deposing a doctor, that's why you're deposing them, right? To get that
Yes.
causation opinion. I mean, there's not usually another reason to depose them because the medical stuff, I'm going to tell you, is pretty boring to jurors. So if you don't need it in your jurisdiction for some reason, or you don't need that particular doctor, then you should always ask yourself, do I need this witness? And are they helping me move the ball forward?
So why do we call doctors? I mean, we have medical records. Why don't we just try the cases with the records?
Well, for one of the reasons you just said, which is if we need um, some testimony about causation, what was the cause of the injuries that the doctor treated them for, that's usually not found in the medical records. And a lot of courts have said the medical records alone are not sufficient to prove that element of your negligence case, right? You have to prove that the injuries were caused by the crash, and a doctor can handle that for you. Um, the other reason is that a lot of jurors are unfamiliar with the types of injuries and treatments that your clients have gone through. So, a lot of people haven't had a back surgery or, a shoulder surgery or a knee surgery or something like that. And so they're unfamiliar with how those things could be injured and what kind of treatment is necessary. And so without a doctor, your client isn't going to typically be able to draw that link, right? How am I injured when I don't look injured? Is sort of the question that the doctors are answering.
Yeah, I've never tried a case without calling some kind of medical professional. Now, some smaller cases, it was a chiropractor, not a medical doctor, but I've always called somebody. And I do think that I know in Texas, for example, for the vast majority of injuries, anything other than like a cut or a broken bone, you have to have medical opinion testimony, and the records alone aren't going to do it. Even if you have a statement of causation in the records, in most courts, the records alone will not do it. You need to call a doctor. And the other thing is the jurors expect it. If you have a real injury and you're asking for real money, they want to hear from a doctor. They don't want to just hear your client saying they got hurt. So even if your jurisdiction would allow you to try it on just the records, means spend the money and get the doctor.
Yeah, yeah. So I think we should jump into it then. So
Yep.
people came to listen to this podcast for how do you do this direct examination? So what do you always start every single witness with, Michael?
What is your name? It sounds
You know,
silly, but it's especially in a deposition. If you're going to play the deposition at trial, you need to ask them what their name is because the jury doesn't know.
right, right. And I feel like I constantly have to remind myself of that too, because, especially when you're doing a deposition on Zoom, it usually says their name on the Zoom, but you have to make a transcript too. And it's important that the witness introduce themselves to the jury. The jury doesn't know who this person is or why they're here,
Yep.
right? And so starting with your name and then what are you doing here? What is your role here?
Yeah.
Why are you involved? Is sort of the next follow-up question to that, I would think.
And you want to, yeah, what is your role in the case? And hopefully you've worked with a doctor. Now, I'm hoping they'll say, I'm a doctor that treated Jane Smith. A lot of
Right.
times they just start going into it but and then they want to like ramble, but you hopefully are here to say, I'm a doctor or I'm a doctor that treated, John Doe, the plaintiff. And then
Right. If you
go ahead.
Well, if you have a rambler, so you can usually tell when you talk to the doctor if they're going to be able to do what you want them to, or if they're going to be one of these people that's just going to try to answer every question with this long, long narrative that's going to be objectionable and it's going to be problematic. So if you know they're not going to answer the question properly of what is the role in your role in this case, you can ask the question, did you treat Jane Smith
Right.
for injuries related to a crash?
Yes.
Yes, I did. Right. I mean,
Right.
that's not a leading question. It's just
Yeah.
it happens to be a yes or no question, but it's not leading. So you can ask questions that help move it along to get to where you want to go. It doesn't have to be so open-ended.
Yeah. I've also, it's like, what do you do for a living? I'm a doctor.
Yeah.
What are you here to talk? And the third one, like, what are you here to talk to us about? But you want to orient, who is this? What, why are they here? What are they here to talk about? So that they hopefully have said, my name is so-and-so. I'm a doctor that treated the plaintiff. And of course, use the name, not the word plaintiff. And I'm here to talk about their care and the injuries they had and what caused those injuries.
And you want to get that out within the first 2 or 3 minutes of the deposition so the jury can place the witness in the order of things. Okay, who is this? What am I listening for in this testimony? I think a lot of people make the mistake of just jumping right into the qualifications of the doctor,
Yeah.
and the jury doesn't even really understand why there's a doctor here yet. And so they're not sure what they should even be listening for in the testimony.
Yeah. Absolutely. No, and hopefully that's all in the first minute, not even the first 2 to 3
Right,
minutes. I
right.
mean, it's just should be really quick and simple. Then, if you have a doctor that can do it, they can't all do it. But if you have a doctor that can, you prep them, starting with a short summary, especially if you're doing by a lot of times it's hard to get a doctor to trial live, and so you do them by video deposition. And this is really effective by video deposition because you have the whole transcript and you can show the judge, I'm proving this up later. But if you can start with a summary so that the jury knows what they have to say, and then you've made your case in the first 5 minutes rather than the first 30. So by that is, what injuries did the defendant cause? What did the plaintiff endure, which is you're talking about the symptoms. What did you do to try to help? What does the future hold? If you can get those 4 things answered early on, and then you can go back and start with qualifications and everything else, it is much better. Because that way, for the jurors, especially on video, it is so hard to watch a 30-minute video. I mean, think of a TV show. A 30-minute TV show isn't 30 minutes of content. A 30-minute TV show has commercial breaks, so they're breaking it up. You're probably watching 24 minutes. Then you have multiple scenes. You have multiple characters. You don't just have, an interview that's that long. I guess there's podcasts, but that's probably why we listen to podcasts to go to sleep.
Or while you're driving and doing something else, right? I mean, so I do have a question for you, Michael. You said if the doctor can do it, what do you mean by that?
Well, I mean, you work with your doctor. You've hopefully met with a doctor before, and you try to get them to summarize the case. Some doctors are capable of being succinct in summarizing the case. I have found other doctors, they have to have a record in front of them, and they want to read through what they have in the record. And if you ask them that question to summarize the case, they will have a 15-minute non-responsive answer that will be stricken and unplayable
So,
and impossible to follow.
so if you were going to play a doctor in this podcast, and what kind of answer would you be looking for? Let's just say it's a herniated disc case, lower back, there was a back surgery. So if we were going to play this out and I said, doctor, what injuries did the defendant cause?
Well, the main injury that the defendant caused when he crashed into John's car was an injury to the back. It's an injury called a herniated disc.
And so here then, Michael, you wouldn't start getting into what's a herniated
No,
disc
not
and
yet.
how does
No,
that happen, right?
this is
You
a
would just go
summary.
into the next, right,
Yes.
just into the next question, which is what did the plaintiff endure because of that injury?
Well, he had a lot of pain in his back, and that pain went down into his legs, and the pain was severe enough where it interfered with his ability to do his daily activities, like walk for very long, stand for very long, trouble getting in and out of bed.
And so then, doctor, what did you do to try to help John?
Well, we tried what they called conservative care, which was physical therapy, medications. When that didn't work, we did a series of injections, and they're not just regular shots. They're called spinal injections. And when that didn't work, we had to do back surgery.
And so now that John's had that back surgery, what does his future look like?
Well, the back surgery helped with some things. He doesn't have the pain down the legs. He can walk a lot better. But unfortunately, it's not a cure. And he's unfortunately going to have pain the rest of his life. And as he ages, the back is going to age more rapidly, and it's going to develop more problems in the future.
Okay. And so I wanted to demonstrate that just so that people could see what we mean by summary. That was what did that take? 45 seconds, a minute
Mm-hmm.
to get through all 4 of those questions. We got this succinct summary. Unfortunately, because of the way that the law is, you can't just stop there. We have to go in now and prove up why he has each of those opinions, how he formed those opinions, what the basis for them is. But it gives the jury a roadmap for where you're going for this deposition.
And everyone's probably still paying attention at this point, because as you go on, you're not going to have the attention of all of the jurors all of the time after 5 or 10 minutes. There's going to be somebody wandering off at any given time.
Yeah. So one of the things that I noticed in your answer is that you framed the answer in terms of liability. So when the driver hit John, it caused X, Y, and Z.
Right.
Why would you do that? Or how do you make a doctor do that?
Well, I think we actually have to do it in our questions. I don't think we can expect our doctors to do that. Now, sometimes they'll repeat back to us when we do it in our questions. I got this from Mark Mandel, actually, a long time ago when I interviewed him for this podcast. I used to try cases, we'd talk about liability, and then we just talk about damages as if it was just something that happened. Like, what happened to his back? Because of the herniated disc, because of his back problems, what is he suffering? Well, no, we're not here because he's suffering a herniated disc. We're here because the defendant ran a stop sign and hurt him. So, when the defendant, when Acme Trucking's driver ran a stop sign and slammed to the side of this car, what injuries did John sustain to his back? Or what injuries did it cause to John's back? Or what injuries did Acme Trucking's driver cause when it slammed into John's car? Whatever. You can word it different ways, but you want to tie your liability facts into your damages questions whenever possible.
Yeah. Um, so once you get kind of that little summary, how do you like to then proceed into the rest of the deposition, the proving it up part?
Well, then I have an outline, and I've used the same outline for a long time. So then you want to go into what you need to do to keep a verdict and what you need to do to show that your doctor's testimony is reliable and follow the reliable methodology. And so basically you want to show that the doctor is qualified, that the doctor used a reliable method called the differential diagnosis method to thoroughly figure out what was wrong with your client and what caused it. Then you want to go into, what was wrong with your client, what caused it, what treatment they had, what the prognosis is. I can go through the exact order, but so my outline, that's actually qualifications, history, or what the client told them, physical exam, any diagnostic testing, and that includes imaging, the diagnosis, what treatment was given, prognosis, which is how they're going to be in the future. Then I go tie it up with causation, proving up costs if I'm choosing to put in the medical bills, which we usually don't, but sometimes you do. And then I try to end with a strong point.
Okay. So when you're going through a doctor's qualifications, are you going through every single thing they've ever done, or, are you just kind of hitting the highlights?
Absolutely not. And the last thing you want to do is go through like a 20-page CV and every publication and every presentation and every course taken. I mean, basically, what does the jury need to know? What kind of doctor they are, that they went to medical school, that they're licensed, are they specialized in something, are they board certified in something? That's it. If they practice in the community for a long time, maybe. If they've done a lot of these kind of things, maybe. But that's really what you want to hit on. So, like I went to medical school, I got licensed, I got what's called board certified. What does that mean? Well, I went and took, additional testing and additional experience so that I specialize in this area. And I've been doing this for 20 something years, and I've done 1,000 of these.
Right, right. I like to call out things that the jury might recognize, like like you said, board certification, or if they went to like Harvard for medical school, or something that's going to be impressive to the jury. Otherwise, I don't like to get too far into, well, now where did you do your residency, and where did you,
Right.
all of that, because it's not really going to mean that much to the jury. They
Yeah.
just want to know that this person did the things that they're supposed to do to be a doctor.
Exactly. And I think, it's not required. I mean, they're required to be a doctor and to have some knowledge, experience, and training in this area of medicine that they're testifying on, but you don't need to go through everything on their CV. It's not required.
So then sort of the next group of things you talked about is really what happens at the first medical appointment, right? The history, the exam, the diagnostic testing review, and then the diagnosis. One of the things I like to do is I like to throw in a little buzzword there for a judge, which is, what is the method that doctors go about to find out what's wrong with someone? And
Absolutely.
they like that word method because, again, you're tying it back to what you're required to show under your Daubert standard. So their method is to do these things
Yep.
to figure out what's wrong with someone.
Absolutely. And I think, the method starts with the history. And of course, you don't want to just let them say the word history. What does that mean in plain English, doctor? Well, it's what the patient told me. So what do they tell you? And again, with the history, hopefully you've worked with the doctor and they're just going to talk about the pertinent history. In other words,
Right.
if their back hurts, well, they got in a car crash, their back started hurting. It hadn't hurt before. It kept hurting, and the pain is going down their legs. It's a sharp pain, 10 out of 10, something like that, and not say, and they didn't have a headache, and they didn't have, in going through, and they had a gallbladder surgery when they were 12, and everything else that might be in the history notes, because a lot of times they just want to read the whole darn thing, and that's why you need to work with them and help them make an outline of, I'd rather have a good outline, let the defense see that they have an outline, as long as it's all stuff in the records, uh, than have them just wander and meander and have testimony that's not very good.
Yeah, I've talked to quite a few attorneys that are so afraid to talk to any witness, including doctors, before the deposition because they're afraid of that cross-examination question. Did you talk to Miss Peacock before this deposition? And I found that whenever that question is asked, the doctor says yes. And then that's the end of the
Yeah,
line of questioning about it. I mean, it never ends up being anything. And I think jurors think that you should talk to the witnesses ahead of time. I think that's expected.
I would fire my lawyer if he didn't talk to the witness before he put him on the stand. My gosh.
Yeah. Yeah. But I think people are afraid of that cross because I guess the implication is that somehow the plaintiff's lawyer told the doctor what to say or something
Right.
like that. But, it's never the case that I've ever told the doctor what to say or told him to lie or something, right? It's just making sure we're on the same page about what this deposition is about. It's not just generally a deposition for you to read your records to me.
Yeah.
The purpose, it has a specific purpose in the case, and they need me to explain that to them.
Yeah.
So after the history, then you talked about asking about the physical exam. So what do you want to know about the physical exam, or what are you trying to get out of the doctor there?
I want the doctor to show what examination findings the doctor had to show that my client that supported the diagnosis. So, if it's a herniated disc, that they do a straight leg raise and we explain what that is and what it means. So, if the straight leg raise is that you lay them down, you raise the leg up. If they have pain shooting down their leg, then that's consistent with something called a herniated disc that we'll get into in a little bit. Uh, whatever the test is, they don't need to go through every single test they performed, but it's also important that they show how they did it. You want to show the doctor was thorough, that they actually did testing, and that the testing supports their diagnosis and the physical exam.
Yeah. One thing I like to ask the doctors during prep is what are the physical examinations that you did that told you there was a herniated disc or whatever the
Right.
diagnosis was? Because then let's talk about those. We don't need to talk about the ones that
Exactly.
are just like testing their, blood pressure or something. I mean, we don't need those tests.
And that's why you have to work with the doctor. So they're a lot of them default too. They get a little bit nervous and they just want to read everything off the record.
Mhm. Right. And so then there's a review of records and other and diagnostic testing that they do.
Yeah.
Do you usually have them actually show the diagnostic testing, like the actual films from MRIs to explain them?
Sometimes. Now you want to think your goal is to persuade. And
Right.
so if you have, let's say, like a MRI of the low back, and you can see from like the sagittal view, which is a view from the side, that there's a big disc sticking out. And when you explain it to somebody, it's obvious and you can see it. Then show the film. If you have a shoulder or a knee MRI, I've been looking at these things for 30 years. I can't understand what they mean. I have to really, so in that
Yeah.
case, I would rather use the report. Other things like an EMG, other certain types of diagnostic testing, you might want to show the report, but there's not really a way to show, it's not an image to show. But I do think it's important to explain what it is, what you're looking for, and then show something, whether it's a report or whether it is uh, an actual image. Now, if the image is clear, and then you should always show it. If the image isn't clear, well, then you shouldn't, unless you think the defense is going to have someone come up and show it. Then you want to own it and show it first, even if it's not as obvious. You can see. You see this little white dot there? That's a high intensity zone. That means there was trauma. So if anyone comes and tells you that there's, nothing but degenerative changes, they're leaving that out. That kind of thing.
Yeah. Yeah. And so then we get to the doctor's diagnosis. And earlier you mentioned the word differential diagnosis. Is that where this piece comes in?
Nope. No, differential diagnosis is going to come in causation. So diagnosis is just this is what is wrong with them. and you have them explain it, then you have them draw it, use a model or something to show what this injury is, show what's wrong with the person.
Okay. Do you prefer like a physical model or something that, just an image you find online or something?
Whatever is most persuasive. And so, sometimes are both. I mean, sometimes we have an image of a disc online on the screen and we have a model spine with the doctor. Now, whenever it's possible, I love to have physical models. Physical things, the tactile things work really well. But sometimes to explain anatomy, if you can find a simple enough chart, it works. There's some great medical illustration people out there, but be careful because they want to make a beautiful, anatomically correct medical illustration, which may show and label so many things that you get lost. So you do, or let's say you pick a stock medical illustration of a herniated disc, and that's a big old disc, and your client has a little disc.
Right.
It may reinforce the defense point that your injury is not that bad, or that's not really a disc, a herniation. So, be careful with it, but, look to see what's available. There's even now companies that will take your MRI and do a 3D printed spine with the actual herniation.
Oh, wow.
And then they cut it in half and you can unhinge it and show from the inside to the outside. It's really cool. But that costs money. That costs a lot more money than just doing a drawing or just getting a custom stock medical illustration off of Google Images. So it's
Yeah.
just, you got to think of the budget of the case. But the biggest thing is whatever image you use, it has to actually make it more likely the jury is going to go with you and not
Right.
confuse the jury.
Right. I found too that if you ask the doctors, a lot of them have a bunch of models in their office, and
Yeah.
it doesn't occur to them to tell you that because, again, they don't know what you're doing. They don't know what you're trying to accomplish by doing this deposition. So I often ask the doctors, hey, do you have a herniated disc model that you use to talk to your patients? And they usually do. They
Yeah.
usually have something in their office that they're comfortable with and that they use with their patients, which I think is even better.
And I think it's better when they can say they brought it from their office rather than something you brought with you.
Right. Mhm. So then the next piece is treatment. So I guess what is the treatment that this doctor and other doctors have provided to the
Right.
to your plaintiff?
What did y'all do to try to help this guy get better or this woman get better? You use a name. What did you do to help Mary get better? Well, we started off conservative. Why is that? Well, we don't want to just jump to surgery. We want to see if we can help her the least invasive manner. So we started off with some therapy and medications. That didn't work. And then we went to, anytime there's something invasive, epidural injection, and then you want to use images or models. And if they have the actual needles, it's good to bring them, show how much it is. I mean, that it's not just like a little shot like you get. It's like a really thing going all the way into the spine. Talk about the fluoroscopy, use the fluoroscopy images. If it's a surgery, you want to go into step by step how the surgery happened. You want to explain the treatment that the client endured because, the fact they're willing to go through all that is evidence that they were really hurt.
Right. Here, one of the issues I usually come to when I get to the treatment piece is this is the part where the doctors want to go through every single medical record
Right.
and say, well, on this day we did this, and on that day we did that,
Yeah.
and this day we did this. And the way to kind of head that off is say, generally, what kind of, if you know kind of what the treatment, you should know what the treatment
Right.
history is, generally, what kind of conservative treatment did they have? Okay, they had chiropractic care. If you know the doctor has a tendency to want to go through every visit, say, about how many chiropractic visits do they have? 20. Okay,
Yeah.
great. And write that down and then move on to the next thing. Okay, then they did imaging. Okay, what kind of images did they have?
Yeah.
So try to get them to talk more generally when they're
Exactly.
talking about the treatment as opposed to giving the specific on this date, they had this procedure.
Yeah.
Here's all the technical terms associated with it.
Yeah. Much better. Like we tried a series of 3 epidural spinal injections, or we tried
Right.
radiofrequency ablation. That didn't work, so we did a surgery. That's the big stuff. Is trying to get them to summarize because when they go through every date and every treatment, it really loses the jury, and you also often highlight any kind of gaps or imperfections you have in your records.
Right. And one of the things that I like to do is I have one of those document cameras on my desk so I can share my screen while I'm taking notes for the doctor. So it's notes for the jury, but it's notes for the doctor too. So the question at the top will be, what treatment did Joe endure? And then as we're writing it down, he'll get the point as I'm going through when I'll say, what treatment did he have? Well, he had 27 chiropractic visits, and I'll just write chiropractic visits.
Yep. We
And
don't need
then
27, doc.
right, did he have any imaging? Well, he had this, 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 and this. Okay, MRIs, right? And so then as I start doing that, then the doctor will start getting it. Okay, I just
Yeah.
want general, epidural steroid injections. And so then by the end of it, I have this cool exhibit that summarizes all the treatment, but it also helps keep the doctor from going back into the
Right.
individual records and reading them.
And they're smart. It's just that they're used to communicating in the way that one doctor would communicate to another. And all that stuff would be very meaningful to a doctor. The exact date, exactly what they did and when is very important to a doctor. It's not important to a jury.
Right, right. So then the next step after treatment is prognosis.
Yep.
So how do you ask about prognosis to a doctor? Do you just say, what's the
So, doctor,
prognosis?
you've after all this treatment, you've done all the way up to the back surgery. Are they cured? Well, how are they doing now? Well, more likely than not, reasonable medical probability. What does the future hold, or what will they continue to endure in the future?
And
And
are
then
they going to
and then
need
you may ask what
treatment?
treatment will they need in the future.
Right, right. And so, that's simple enough. You just, again, you want to keep it as general as possible. And most doctors aren't going to be able to say, well, on December 31st, 2027, he's going to need this procedure. I mean, it's never going to be that specific anyways on this part. So usually they can say generally, I think he's going to need another surgery, or he's going to need physical therapy for the rest of his life, or he's going to need whatever it is. Um, the only warning I would give here is that if you don't have a life care planner in your case, you might need to get a little more specific
Oh yeah,
about the actual treatment that's needed. If you have a life care planner, then they're going to handle the specifics. But if you don't, and your doctor is going to be the one proving up your future care, it does probably need to get a little more specific.
then you need to get costs and where they got the costs from and all that stuff in there. Absolutely.
Right. Right. So then causation. This is the big one that I think freaks a
Yes.
lot of people out. So what do you need to ask to get the testimony you need?
Yeah. So, doctor, the pain that John endured, the treatments that John had to endure, the jury needs to determine whether or not these were caused by the car crash. Do you have an opinion on that? Yes. What did you do to reach that opinion? And hopefully they'll say, well, I did a differential diagnosis. What is a differential diagnosis? Well, I looked at the things that could have caused this. And then based on the history, the physical exam, the diagnostic testing, everything else I did, I eliminated the ones that could be eliminated and determined the most likely cause. So for this injury, back injury, what could it have been? Well, it could have been something called degeneration, which is natural aging. It could have been a prior injury. It could have been a subsequent injury. It could have been cancer. It could have been arthritis. Okay, well, what did you do to determine whether it was arthritis? Well, if they had arthritis, it would have come on gradually. This came on right after a crash. Plus, they would have these other symptoms. You would have these findings X-ray. They don't have those. How about age-related changes or degeneration? Well, degeneration comes on slowly. They're off, most of the time it's not painful. It is not likely that if they didn't have pain before, the pain started right after. It had degeneration. Degeneration is inconsistent, therefore I ruled it out. Well, how about cancer? Well, we looked at the MRI. There was no tumor. It's not cancer. And, so based on that, doctor, what is the most likely cause? The car crash on this date. Did you rule out the other causes with substantial certainty? Yes, I did.
Yeah, I think what's important about that piece is that you definitely need to ask your doctor directly about whatever the defense doctor says is the cause. So if
Yes.
they've hired a doctor that says the cause is degeneration, you need to ask your doctor directly why it's not degeneration.
Yeah.
I mean, you need to get that out there. And is this kind of the area too where you address some of any other of the defense points that they might have?
Absolutely. Prior crashes, subsequent crashes, it just, you have to address all the defense, whether it's psychological or not. That's all stuff that you want the doctor to say they ruled out with substantial. Texas requires ruling them out with substantial certainty. In other words, the test to rule out the defense theories is a higher standard than our test to prove that what our burden of proof is supposed to be. We're only supposed to have to prove more likely than not, but in Texas we have to rule out other potential causes with substantial certainty. That's just the case law.
Yeah. And it's different in every state. So you just have to know what it
Yeah.
is in your state. But I think it's so important to address the defense points. I mean, the doctor doesn't necessarily have to have read the defense doctor's report, although
It
why
helps.
not? But right. But I mean, he doesn't have to. You can summarize those opinions, right? You can say the defense opinion witness is going to say, Dr. blank is going to say X, Y, and Z. Do you have an opinion about that, doctor? Yes, I do. What is your opinion? Well, I don't agree because X, Y, and Z. I mean, it can be that obvious.
Yeah.
Um, so then, if you're going to put in your medical bills in the case, then you would have your doctor talk about the costs of the care. Every state, I think, has different standards for what's required to prove up the medical bills and medical costs. So
Yeah, but basically they're similar. That the treatment was necessary because of the crash, and it was reasonable, and that the costs are reasonable, ordinary costs in the community. Most states have that as their basic requirement. So, just ask them how they know that. Well, I'm familiar with my costs. I'm familiar with other doctors' costs in the community, and these are reasonable, within the realm of reasonable. Yeah, that's all. You don't want to go you don't want to make the case all about the medical bills. So sometimes we don't even put them in,
right,
but you definitely don't want to spend forever on those. And if you're going to have multiple doctors' costs, you want to get a summary exhibit where you just have one list of all of them. You don't want to have like a bunch of bills, just like a summary exhibit. You may have to have the bills behind it, but chiropractor $15,000, MRI $8,000, whatever they are, and just itemize them and have the doctor say it's all reasonable and this is what the total is, and make the math easy for the jury.
right, right. And then the last piece, in your outline that you use is ending with a strong point. So what do you mean by that?
It's good to have the doctor end with a question that's going to have an answer like they're going to have substantial pain until the day that they die. And as they get older, it's going to keep getting worse. So, doctor, what does the future hold? Is this pain ever going to go away? No, it's not. It's not going to go away. It's lasted more than a year. It's called chronic pain. How long are they going to have it? Unfortunately, they're going to have it until they die. Is it going to get better with age? No, it's only going to get worse. Thank you. I'll pass the witness. I mean, end strong.
Right.
And again, you got
Um,
to practice. You got to work with them, and they're going to say, "Are you rehearsing the test?" You're not rehearsing the testimony. You just make sure you know what the answer is going to be, and work together. And it's much better to have the cross examination point of, like you said, well, you all met before, you went over this, than it is to have crappy testimony and no
right,
cross needed.
right. I usually, and I always tell witnesses, you're going to be asked if we met before. It is absolutely okay that we met before. You should say yes to that question. There's just nothing to hide here. And it just makes the witness feel more confident going in that there's nothing secret about this. There's
Yeah,
no problem with this having happened. And then what ends up happening, like I said, is they say, did you meet with Miss Peacock? And the witness just says, yes, I did.
yeah,
What did you talk about? We talked about what I was going to say today.
yep,
Okay.
yeah. Then
I
it's done.
mean, it ends up not being that surprising, I guess.
Yep.
Um, One other thing I like to do, you mentioned ending on a strong point, is I always like to have the last word. So especially with a doctor, because it gets in the weeds, especially on cross, a lot of times the defense gets in the weeds. I usually don't talk too much about what the defense talked about on cross examination, but I like to do a redirect that again follows up on my strongest point from
Yep.
their cross examination. I address what I need to address. I try, if I don't think I must address it, then I don't, right? So bringing up the defense points again makes it seem like they had a good point,
Right.
right? So you have to be careful what you continue to bring up because then the jury's going to think you're worried about it. But I like to do a small redirect just again so that I have the last word and the doctor's testimony is ending with a strong point.
Absolutely. I think the final thing that wasn't exactly in the outline, but while you're doing the entire direct, uh, always remember what your role is in the case. You're supposed to be the juror's trusted guide. And so whenever the doctor uses any term that is a technical term, you don't want to embarrass the jury. You don't want to act like you're talking down. Just make them interpret it. Doctor, you said herniated disc. What is that in plain English? Doctor, you said radiculopathy. Can you show us what that means in plain English? And that way, anytime there's any word where some juror might wonder what it means, you're there to ask the doctor to explain it in plain English, at least the first or second time.
Yeah. Yeah, I think that's so important because I think and I've heard, I can't remember who said it, that you should come in with a beginner's mindset.
Michael Loserman or Buddha. But
Yeah,
yeah,
right. But really in terms of the medical, because a lot of lawyers who've been doing this personal injury work for a long time, you know the terms, You know what the treatment protocols are. You know what the different procedures are already. Most people in your jury have never heard of any of these words before.
Yep.
And so you just need to make sure that you're getting the doctor to explain in regular people terms, what is a cervical fusion? What does that mean?
Exactly.
And how does that work? And you have to ask the questions that a juror would be wondering. Are there side effects? Are there possible risks of having a
Yeah.
cervical fusion? Do you have to go under anesthesia for that? Those are things that are obvious to us, but a juror is going to be wondering that, and it does help your case to go through those kind of things. Like, hey, there's a risk of death. You have to go under anesthesia for this procedure.
Yep.
These are the waivers you have to sign. I mean, that shows that it's a really serious procedure and it's a serious injury. You wouldn't be doing that unless you're in a lot of pain. So, but asking those questions, that if the juror was going into the doctor and the doctor was telling him you're going to have a cervical fusion, what would the juror want to know about that procedure?
I hope this has been helpful to our listeners. I mean, we've worked a long time trying to simplify this. I used to do them much longer and much more confusing. And I think our results have gotten better and better as they've gotten shorter and more clear. So, Mallorie, thank you for joining me today to talk about this stuff. I look forward to the next installment of our trial series and hope everyone else joins us on our next episode of Trial Lawyer Nation.